Good day, everyone. Today I'm going to discuss the drug study of opioid analgesics, non-opioid analgesics, and the hematologic drugs. I will be discussing their mechanism of action, their contraindications, side effects, and the nursing responsibilities. Please be with me till the very end of this video, and I'm gonna make sure that all of you will be able to learn about these drugs. So let's start with the opioid analgesic. What is opioid analgesic? Opioid analgesic are a class of medication used in the management and treatment of pain. I will give you three generic names under this drug classification, and they are oxydone, hydrocodone, and the morphine. Let's go with the oxycodone. The mechanism of action binds with opioid receptors within central nervous system, causing inhibition of ascending pain pathway. Its contraindication is the hypersensitivity to oxycodone, acute or severe bronchial asthma, hypercarbia, paralytic ileus or known or suspected, GI obstruction, significant respiratory depression. Another thing is its side effect. Side effects are dependent on the dosage amount. So if the doctor will give you, for example, 500 milligrams and you took 1000 milligram, then that's the side effect. There's a certain side effect that will happen to you if you took not prescribed number of milligrams or ml. The nursing responsibilities of this oxycodone is first, palpate bladder for urinary retention. So the nurse should palpate the urinary retention of the patient, monitor daily pattern of bowel activity and stool consistency. Another thing is that initiate deep breathing, coughing exercise, especially in points with pulmonary impairment. So we are going to monitor or to observe the breathing of our patient, coughing exercises, especially for those patients who has asthma or has pulmonary impairment. Now, let's go with the hydrocodone. The mechanism of action is binds with opioid receptors in the central nervous system. Its contraindication is that hypersensitivity to hydrocodone, significant respiratory depression, acute or severe bronchial asthma or hypercarbia, and then the paralytic ileus. Its side effect is that it has urine retention, blurred vision. So if you're going to take again not prescribed, not a prescribed one, you are going to take, like for example, as what I example earlier, not desired amount of milligrams or ml, then this may cause blurred vision, constipation, so you're going to experience constipation, dry mouth, headache, nausea or vomiting, difficult painful urination, euphoria and dysphoria. So these are the side effects if we are not going to follow what the doctors order as to how we are going to take the hydrocodone. So what is the nursing responsibilities with this medication? So its nursing responsibilities is that, again, we're going to palpate bladder for urinary retention, monitor daily pattern of bowel activity, stool consistency. So we're going to monitor the patient's bowel activity. So how many times did he stool, or how many times did he has bowel activity, or how was his stool? Is it dry, or is it hard, or what? And then initiate deep breathing and coughing exercises particularly in patients with pulmonary impairment. So again, as what I've discussed earlier, so no, we are going to initiate the breathing of our patient. Again, practice coughing exercises. So especially to those patients who suffer pulmonary impairment. Now, let's proceed to the last generic name, which is the morphine. So, the mechanism of action under this morphine is that binds with opioid receptors within central nervous system, inhibiting ascending pain pathways. So, its contraindication is that hypersensitivity to morphine, acute or severe asthma, GI obstruction, known or suspected paralytic ileus, severe hepatic renal impairment, severe respiratory depression. So we should always remember this contraindication of the morphine. And then what is its side effect? So if we are going to ask, no, we should always remember the side effects of our medication. So the side effects of morphine is that may experience nausea, again, vomiting more frequently than patient in supine position or who have severe pain. So they will experience vomiting or frequently in vomiting, no, if we are not going to follow again what the doctors order or not obey. If we are the patients and we are not going to obey what the nurse told you or the doctor told you. So this would be the possible, or I mean not possible, this what will happen to you if you are going to not obey. So this is one of those side effects that will happen to you if you don't obey the nurse or the doctor's order. And then what is the nursing responsibilities to morphine? So be alert for decreased respiration, BP, check for adequate voiding, monitor daily pattern of bowel activity, stool consistency, and avoid constipation. Again, we as a nurse, we should not be tanga-tanga, but we should always monitor our patient. So most especially those who have severe pain, because we don't know, no, even if we know that pain is really pain, even if it's a single wound in your hand or somewhere in your feet. But when we know that it is pain, it is really pain, no, sakit jud siya. So how much more to those patients who really had suffered pain. So that's why they were in the hospital, because they needed not first aids, just not, I mean, when we are at home, we just give them a first aid, or putangin lang nagbayabas, or taplaki lang nagbayabas, maayon na. It's not like that. That's why they went to the hospital, so that they need professional help, because pain is pain. So no, we see that we as nurses should be alert for decreased respiration. We should monitor its vital signs as much as possible, so that we may be able to know our patient if he or she is really like doing well, or needs more, needs more attention, or what we see that what are the nursing interventions that we really need for that certain person, for that certain patient. Again, last nursing responsibility again is that we should initiate deep breathing, coughing exercises, particularly in those with pulmonary impairment. So as we all know, the three of them, the oxycodone, the hydrocodone, and the morphine, they really have almost the same, contraindication, side effects, the nursing responsibilities. But they are different when it comes to its content ba. They are belong to the drug classification of opioid analgesic, but each one of them has unique content that must be taken to the patient. So that's it for the opioid analgesic. So again, there are three generic names under drug classification of opioid analgesic. They are the oxycodone, hydrocodone, and the morphine. Now, let's proceed to the non-opioid analgesics. And these are medications that are commonly used to treat mild and moderate acute and chronic pain. So, earlier I discussed about the opioid. So these medication or these drug classification are used for the management and treatment of pain. Now, non-opioid analgesics are also a medication for pain, but it is only to treat mild, moderate, acute, and chronic pain, not just severe. Unlike what I've discussed earlier, it was really needed to be focused, needed to provide further health intervention. But this one, it is like mild lang, so just mild. Okay, now I will give you three generic names of non-opioid analgesic. They are acetaminophen, the aspirin, and the ibuprofen. Now let's proceed to the acetaminophen. So its mechanism of action is that appears to inhibit prostaglandin synthesis in the central nervous system, and to a lesser extent block pain impulses through peripheral action. So that is its mechanism of action. Now, its contraindication is that hypersensitivity to acetaminophen. So it's hypersensitivity. Its side effect is that it's hypersensitivity reaction. So it's reaction. Now, their nursing responsibility is that assess for clinical improvement and relief of pain or fever. Now, let's proceed to the aspirin. Its mechanism of action is that inhibits cyclooxygenase enzyme via acetylation. Okay? Its contraindication is that asthma, rhinitis, nasal polyps, inherited or acquired bleeding disorder, used in children younger than 16 years old for viral infection. Its side effect is that GI distress, including abdominal distension, cramping, heartburn, mild nausea, allergic reaction, including bronchospasm, pruritus, and urticaria. So these are the side effects of taking aspirin. Its nursing responsibilities is that if given as antipyretic, assess temperature directly before and 1 hour after giving the medication. So last is the ibuprofen. Mechanism of action is that produces analgesic, anti-inflammatory effects, and decreases fever. So ibuprofen, it's like paracetamol, no? We Filipinos, even at home, if we feel sick, if we feel like we're not feeling well, we usually take this kind of medication, just paracetamol, like ibuprofen, so that it can help us decrease our fever. Yes, and this is the best example of this, the ibuprofen. Contraindication: history of hypersensitivity to ibuprofen, aspirin, and other NSAIDs. Side effects, again, nausea, vomiting, dyspepsia, dizziness, and rash. So these are just the side effects if you're going to take ibuprofen. So the nursing responsibilities of ibuprofen is that monitor for evidence of nausea, dyspepsia, assess skin for rash, observe for bleeding, bruising, occult blood loss. So that's it. I think that's it for the three generic names of non-opioid analgesic. Again, first is the acetaminophen, aspirin, and the ibuprofen. Now let's proceed to the last drug. It is the hematologic drugs, and I believe there are two drug classifications. The first one is the anticoagulants and the thrombolytics. So they belong to hematologic drugs. Before I proceed, hematologic drugs is that drugs that act on blood and blood-forming organs and those that affect the hemostatic system. So that is the meaning of the hematologic drugs. So again, in the anticoagulants, there are three generic names. So they are apixaban, the bigatran, and the warfarin. Let's go to the apixaban. Its mechanism of action is that it inhibits clot-induced platelet aggregation, fibrin clot forming. So its contraindication is that it will have severe hypersensitivity to apixaban, active pathologic bleeding. Its side effects are nausea and ecchymosis. So the nursing responsibility of apixaban is that periodically monitor CBC. So again, you're going to monitor its CBC. Stool for occult blood. Be alert for complaints of abdominal, back pain, headache, confusion, weakness, vision change. May indicate him. Next is the dabigatran. So mechanism of action is that direct thrombin inhibitor that inhibits coagulation by preventing thrombin effects. Example, inhibition of thrombin-induced platelet aggregation. Its contraindication is that severe hypersensitivity to the bigatran, active major bleeding, patient with mechanical prosthetic heart valves. Its side effect, frequent, less than 16%. Less than 16%, dyspepsia, heartburn, nausea, indigestion, diarrhea, upper abdominal pain. So these are the side effects. Nursing responsibilities is that assess for any sign of bleeding, hematuria, melena, bleeding from gums, petechia, bruising, decrease in BP, increase in pulse rate, complain of abdominal pain, diarrhea, obtain PTT, PT, platelet count. So we are going to assess these things. Mag vital signs ta, i-check nato ato ang patient from head to toe if naaba sila complain ani, so that we may be able to know if there's a progress or not, if really needs to further assess pa jud, further give pa jud og health intervention. Last is the warfarin. So its mechanism of action is that interferes with hepatic synthesis of vitamin K, dependent clotting factors resulting in depletion of coagulation factors. So contraindication is that hypersensitivity to warfarin, hemorrhagic tendencies, side effects, GI distress, nausea, anorexia, abdominal cramps, and diarrhea. Its nursing responsibilities, monitor INR diligently as a CBC for anemia, urine stool for occult blood, be alert to complaints of abdominal, back pain, severe headache, confusion, seizure, hemiparesis, aphasia, maybe sign of hemorrhage. And again, let's proceed to the thrombolytics. So there are two generic names, the altiplase and the tenecteplase. So altiplase, mechanism of action, binds to fibrin in a thrombus and converts plasminogen to plasmin, initiating fibrinolysis. So its contraindication is hypersensitivity to altiplase, active internal bleeding, AV malformation or aneurysm, bleeding, diabetes, CVA, intracranial neoplasm, intracranial or intraspinal surgery or trauma. So side effects, superficial bleeding at puncture sites, decreased PP, allergic reaction, rash, wheezing, breathing. Nursing responsibility is perform continuous cardiac monitoring for arrhythmias. So again, let's go to the tenecteplase. Mechanism of action, produced by recombinant DNA that binds to fibrin and converts plasminogen to plasmin. Contraindication, active internal bleeding, cerebral aneurysm, AV malformation, bleeding, diathesis, history of CVA, intracranial or intraspinal surgery or trauma within past 2 months, intracranial neoplasm, severe uncontrolled hypertension. Its side effects, bleeding, minor 21.8%, major 4.7%. The nursing responsibilities of this is the monitor continuous EKG for arrhythmias, BP, pulse, respiration, quarter 15 minutes until stable, then hourly or per protocol. So I hope you remember something from our discussion today. Again, thank you so much for listening. Thank you, and once again, God bless you all.